Hi, everyone. I'm Heather Bouchard, and today I have the pleasure of speaking with Dr. Michael Kirkwood, who is a pediatric neuropsychologist and professor in the Department of PM&R at the University of Colorado School of Medicine. He is the director of the Rehabilitation Psychology Program at Children's Hospital Colorado, and he also co-directs two clinical programs, including the hospital's concussion clinic and the Rehabilitation Department's Functional Neurological Disorder Clinic. Dr. Kirkwood will be speaking at the upcoming SNS Symposium, giving a talk titled Post-Concussive Functional Neurological Disorder in Kids and Teens, What It Looks Like and What a Neuropsychologist to Do. Dr. Kirkwood, thank you for being willing to speak with me today.
Oh, my pleasure. Thanks for having me, Heather.
To start, can you describe how you recognize functional neurological disorder or FND in children and teens after a concussion?
Sure. So F&D can appear for lots of different reasons, but one of them is physical illness or injury. So a concussion is a type of injury that can lead or trigger, lead to or trigger FND. And we see this actually regularly in our concussion clinic, but then also in our FND clinic here at my hospital. And differentiating post-concussive symptoms from FND symptoms can be tricky because there's substantial overlap between the two symptom sets. But FND is typically characterized by more significant symptomatology. So, for example, in the context of concussion, you might expect mild balance problems, but balance problems significant enough to cause frank ataxic gait some days or weeks after injury, or the need of assistive devices like a cane or wheelchair would strongly suggest FND. Mild word finding problems are not uncommon soon after concussion, but stuttering, for example, would be an example of FND symptomatology after concussion. Concussion can cause mild attentional problems, as everybody knows, but severe memory problems, like kids saying they no longer can learn or remember any information at school, or they've lost memory of their friends or their siblings or something like that, that would suggest FND symptomatology. And then there are some symptoms that appear after concussion that are unusual, would be unexpected after concussion, which would also indicate FND presentation most likely, and that would be functional seizure or tic disorder happening after concussion.
How do you go about talking about these different symptoms to either your kids as patients or their parents or family members?
We found that it's important to say what FND is, of course, but also important to explain what FND isn't. And because FND symptoms after a concussion are most of the times more severe than common post-concussive symptoms, some families assume that the symptoms, or have been told that the symptoms reflect more significant underlying brain injury. So more severe brain injury is causing these more severe symptoms. So it's important in the context of concussion to provide reassurance that this isn't the case. So we typically start with the fact that the symptoms do not reflect brain damage. So there was a head injury or brain injury, but that did not cause brain damage. And brain damage is not why we're seeing these post-concussive symptoms. So we often use the computer analogy that the brain hardware is okay in cases of FND. So in addition to saying what FND isn't, it's also important to explain what FND is. So symptoms, as I said, aren't a problem with the hardware, but they are a problem with the brain software. So essentially, there's a glitch in the software signaling between the brain and the body. And that's what's producing the FND symptoms rather than a structural lesion with the brain or structural pathology. Many of the kids that we see in our clinics who have FND symptomatology have had their symptoms dismissed because a healthcare provider has told them that they're not neurologically driven. So the symptoms have been dismissed, or some kids have been told that they're faking the symptomatology. So another important thing that we do when we're trying to provide education to the families is really validate kind of the family symptoms or the patient's symptoms and the family's experience. And recognize that the symptoms, even though they're not caused by brain damage, the symptoms are very real and oftentimes very disruptive to the kids and to the family. So many kids with FND are missing considerable amounts of school, or they've withdrawn from sports, or the parents themselves have needed to miss substantial work to help manage some of the symptomatology that's been there. So this validation kind of process is another important thing that we try to provide in our messaging. And then finally, we also kind of try to end the psychoeducation on a positive note, and that is that FND symptoms in kids after concussion, in our experience, are most of the time temporary. And so with proper treatment and management, we can help the families kind of leave the symptoms behind. And so ending on this positive note is something that we try to do as well.
So it sounds like that validation is really important and the psychoeducation is really important. How might that treatment and management look different for kids and teens compared to maybe more adult patients?
Yeah, you're exactly right. Is that there are similarities between treating kids and adults with FND, and psychoeducation is for sure step one kind of in both populations. And there are some interventions that have been validated in both populations. So PT or CBT have both been found to be worthwhile in kids and adults. Multidisciplinary management, especially when symptoms are more severe and more disruptive, is another commonality between kid management and adult management for sure. The primary difference in management when you're working with kids versus working with adults is those of us who work with kids, by definition almost, have the luxury of having a larger management team. And that's because we get to work not just with the individual patient, the child or the teen, but we're working very closely with parents. And in the clinics that I'm involved in, we're also working hand in hand with school personnel. And so when you're working with adults, I think many providers are oftentimes limited in their work to just the patient. But when you're working with kids and teens, you can change some of those environmental contingencies that might be apparent in the home and school settings that are maintaining the symptoms, and really try to institute kind of in these everyday settings things that we know can improve outcomes, so minimize kind of FND symptoms. So we're not just working with an individual patient, we're working with the parents and the schools to help encourage the kids to use more effective coping when they're having FND symptomatology. We can also encourage typical activities by talking with parents, by talking with school personnel. Many people with FND have a tendency to withdraw from their typical activities, but we can encourage parents and schools that kids should be going to school on an everyday basis. So they shouldn't be staying in their room every day, and that can really make a difference. Sometimes symptoms, FND symptoms, can be reinforced in these everyday settings, and we can work with parents and school teams around minimizing the reinforcement that some of those symptoms may get naturally. And then we also can work with parents around just this general focus on brain health. So encouraging kids to get back to regular exercise, or to get back to their kind of baseline level of sleep, because sleep is oftentimes disrupted, not only in concussion, but in the context of FND. So this larger management team, we really value as kind of pediatric providers in my hospital system, and try to bring in kind of and leverage these other folks in reducing the FND symptoms and improving outcomes.
Yeah, that all sounds so great. It sounds like there's a lot of opportunities for multidisciplinary work among different providers and a lot of different treatment outcomes to really target for patients. So I just wanted to thank you again, Dr. Kirkwood, for speaking with me. And I definitely look forward to learning more from your talk about post-concussive functional neurological disorder in kids and teens at the SNS Symposium in Cleveland this May. For those who are listening, you can read more about the conference and how to register to attend on the SNS website. That is sportsneuropsychologysociety.com. And you can also follow SNS on Facebook and Twitter. So thank you again, Dr. Kirkwood.
My pleasure.